Hello and welcome to this session. It's for the third trimester. This is all about preparing us for birth. I've got with me here Lucy on my left-hand side, and I've got Charlotte on my right. Charlotte is 36 weeks and Lucy 35, so 35 and 36. So this is a great time to start preparing for birth. This is all about releasing and relaxing, and it's a bit of about the mindset as well. Now, both Lucy and Charlotte we've been talking about, they both had babies before, so Lucy's on her second and Charlotte's on her third. And we're talking about fears that we may have, things that can make us feel a little bit apprehensive, and that's what we need to address. We want to get rid of those fears. So Charlotte was talking about the fact that her last birth was really, really quick, and she's a bit nervous about that quickness and the fact that she's not going to be able to necessarily use any medication through the birth, so she's probably going to have to do pretty much everything on gas and air. And Lucy, you're going to go for induction, aren't you? So for different reasons, both of them are potentially going to hit that birth, and it's going to be quite fast. So how can we slow ourselves down? So that's one of the things, and how can we calm ourselves down? So that's what our preparation is going to be today. So let's start with some rocking the babies. So we're going to start with just turning the foot in and just allowing the arms to circle around. So we call this rocking the baby. So if you imagine you're holding your baby in your arms, these two are holding their babies in their tummies and just giving them a little bit of a rock. And the reason this is such a nice movement to do is because it's comforting, and it's a really lovely movement to do when you are in labour. So use your rocking the babies. A lot of the women in my classes always use this while during labour, and it's a nice way to pass through a contraction. If you want to, you can use this position, and it's just nice to keep the body moving. And we've been talking about how keeping yourself gently moving is a really good thing to do. So that's why we like this rocking the baby movement. The other movement that's really nice to do is some squats. Now we're going to do this in a very kind of warming way. We're not going to drop too low because we're just starting to warm our bodies up here a little bit. But let's just start off by doing a bit of core connection. So just going to put your hands underneath your bump, take your feet to hip distance apart, put one hand onto your chest and one hand underneath your bump. And we're going to focus on the breath. So I'd like you to take a nice big deep breath in for me and breathe in through your nose. So in through your nose. And you can breathe out through your mouth or through your nose, your choice. And just get that kind of sinking feeling as you exhale. And that's a really important feeling. It helps to relax and take tension away from the body. So you can do that again. Take a nice big deep breath in, inhale. And then exhale. And just allow the body to sink and relax. Now, when you think of the action of the diaphragm and the pelvic floor and your inner core unit, as you inhale, so breathe in again, everything expands. And as you exhale, everything comes in and down. Now the rib cage comes in and down. What happens to the pelvic floor is it naturally lifts. So as you inhale again, the pelvic floor and the diaphragm extend. And then as you exhale, the rib cage comes in and down, but the pelvic floor and the diaphragm come up inside you. So we'll do that one more time. Inhale, they expand. And then as you exhale, they naturally come up and inside you. So there's just a gentle, natural movement of the pelvic floor and the diaphragm. And it's got a kind of like wave-like quality to it. Now what I want you to do is to go into, if we turn to the side, and Lucy, if you turn to face me, then you can see what we're doing. And we're just going to rock on the heels. And we're just adopting a very gentle squat position. Now we're doing this at the moment standing, so our legs are taking a little bit of weight. In a second we're going to get onto balls and do this on the balls. But for the moment you can do this, and you could be using some support. You could actually be holding onto your partner. Yeah, you could be a little bit closer than we are. So you could use a little bit of support if you wanted to. Or you can just do these rocks, or you can hold on to the back of the bed, or if you've got some kind of bars you can use, you can lean onto. But this is a nice movement to do. It's also a lovely position to help bring the baby through. So it's an optimal birthing position, and you don't need to go very, very low. The fact that we're rocking quite a lot. If you were having contraction, you wouldn't be doing this. You'd probably be going still. But the rocking is, again, a nice little movement to be doing whilst you're in labour. Okay, so what we're going to do now is we're going to grab onto the balls. and just sit onto them. And we're going to do exactly the same action but on the balls. Now just rock side to side. In terms of the ball that you've got, you need to have one that is probably a little bit more pumped up than the ones we've got in here right now. So we're a little bit too low down, but if you are using one in labour, you want to be a bit higher up so that you're in that squat position that we were in when we were doing this standing. But can you see we're just doing the same thing, and it's just releasing tension in the body, and it's comforting. It's a nice thing to do. Yeah, so it feels good. So rocking, keeping the body gently moving, is a really good way to release pain and relax and release tension in the body, which is what you want in labour. So all of these things are good. We started to talk about the breath as well, and breathing is really important. So we're just going to hold still so that we can focus on the breath again now. So I want you to take your breath in, so inhale, and then exhale. And I want you to really listen to your breath. Now, I want you now to try and breathe through your nose. So you inhale through the nose, and you're going to exhale through the nose. Now, that's quite hard to do if you're used to breathing through your mouth, but just try it for me. It's a really nice way to breathe, and it slows your breath down. Now, Charlotte was talking about the fact that she's got a little bit of tension in her neck and her shoulder. And often we carry tension through this area. And again, that can impact on the birth. So we're going to do a little bit of release of the upper body now. So the first thing I want you to do is, again, do that breath again. Inhale through the nose, and then exhale through the nose. And what I want you to do is to put your tongue on the roof of your mouth. Get the tip of your tongue, find the ridge, and just place your tongue over the roof of the mouth. Now, I can't do that and speak at the same time, so I hope you're doing it, yeah? So it makes you close your mouth, yeah? So now you have to breathe through your nose. So just try it for me. Inhale. And it creates, it's called Ujjayi breath. It's a yogic style of breath. And it creates this kind of tunneling sound inside your throat. I don't know if you can hear that. And it's kind of closing, the top of the throat comes down, and it kind of widens the throat at the same time. So try it one more time. Inhale. And then exhale. And it's a very calming form of breath. Can you feel that, Charlotte? Yeah? So it's a really nice way to calm yourself down, and I would encourage you to practice this style of breath. You're not going to breathe like that when you're giving birth, okay? It's not that calm when you're giving birth. You're going to roar a little bit, yeah? You're going to want to be able to make some noise. You're going to want to be able to open that mouth. But beforehand, when you want to calm yourself down, when you're in that stage, maybe you're thinking, right, do I now go to hospital? This breathing is going to be really useful for you to do. Maybe before you have your induction, start doing this style of breathing, and we'll practice it again in different positions. So let's just do it one more time. So inhale through the nose, and then exhale, and then just release and relax, and just get that kind of dropping, releasing, relaxing feeling to your breath. So using breath is really important. Using gentle movement is really important as well. So what we're going to do now is we're going to come down onto our knees. So we're going to bring the balls in front of us. And we're just going to begin with, put both of our knees onto our blocks. And hopefully if you can see a side view of us here, we're just going to do a gentle lift up through the pelvic floor. Now, we've been talking about how all through your pregnancy, we're encouraging you to contract the pelvic floor, to lift the pelvic floor. But when you give birth, you want the pelvic floor to open and let go. And so opening the pelvic floor, opening the pelvic outlet, which is the base of your pelvis, letting that release and letting the muscles around the pelvis release. It's really, really important. So that's something that we're going to really focus on now. So let's just do a gentle contraction of the pelvic floor. And I want you to actually put one hand into your lower back, and just be conscious of the fact that when your bump is extended and out, as obviously it is, it does increase what we call the lordotic curve in your back. So you might feel your back just arch quite a bit. Yeah, so you can feel that with your hand behind you. But what I want you to do now is just contract your pelvic floor and have a think about whether the arch in your back decreases. So just take a breath from me. Use that Ujjayi breath we were doing just now. So inhale, exhale, and just contract from the back of the pelvic floor. So stop a fart from the back, draw in for a wee from the front, and just see if your back softens as you do that. Can you feel that? So we're not using any kind of tucking of the pelvis. We're just gently drawing up through the pelvic floor. So just using that support of your pelvic floor helps to reduce that lordotic curve, helps to bring your tummy in just a bit, and it's a nice release for your back. So doing that lift through the pelvic floor is a good thing to do. So let's just do that one more time. Take a breath, inhale, exhale, relax, and just contract from the back of the pelvic floor and into your belly, and just feel your tailbone just drop just a little bit. So the action of pulling up through the pelvic floor should bring your coccyx in just a little bit, enough to feel that back just relax and release. And that in itself can be a release and a relaxing feel for your back. But we want to feel the pelvic floor release as well. So let's focus on the release now as well. So take a breath. You can use your hands on the ball or into your back, wherever you prefer. So inhale, exhale, and then just contract the pelvic floor, lift up from the back of the pelvic floor into your belly, but then just let it relax and drop down. And you might feel your back go relaxed and into more of that lordotic curve again, which is absolutely fine. That's going to happen in labor. That's not a problem. But just you want to feel that feeling of relaxation. So do it for me again one more time. So inhale. And think of the feeling rather than how this looks, because you might not be able to see anything. So just lift up from the pelvic floor, lift in, feel it coming in, feel your belly coming in, and then just allow it to relax and let go and release. So now we're going to take the ball to one side and we're going to bring the left leg up. Now Lucy was telling me that her left side tends to get a little bit tense. So we're using the ball for some support, and then we're just going to come forwards and backwards. And we've done this in other classes as well, and you can use the ball, you can roll it forwards and backwards. But what we want to think about is releasing tension in the hips. So again, we're using gentle rocking movements. You could use all of these movements in labor if you wanted to. If it feels good, do it basically. So what I want you to think about now is that we're just coming forward, lengthening the front of the right thigh, but also think of this left leg, and if you can you straighten it as you come back? Yeah? So you're just getting some length into your hamstrings at the back. Now flex your foot up as you do that. Yeah? And you're just getting some nice bit of length. Now have a look about where your knee is as you're doing this. You don't want the knee at this point to go out to the side, because if you're feeling tightness in this hip, then that's going to exacerbate that tightness. So we just want to keep that knee in for the moment. So we're just rolling forwards and backwards. Now if you don't have any tightness going through into this hip, you could take your foot out to the side and do it at an angle. And if that feels good, just try it. You can bring the ball a little bit more into the center. And we're just trying to relax through the upper body as well as we do this. We're just rolling forwards and backwards. And do that a couple more times. And then we can just hold forwards for a second and just hold forwards. And just feel that length coming into the hips as you do that. And just now focus on your breath again. So take a breath for me. Inhale. Exhale. And just see if you can come forward a little bit more. But it's got to feel good as you do that. But you're just getting a bit more length into that right hip as you do that. So breathe again. Inhale, exhale. Now we can engage the core as you do this. So take another breath. Inhale, exhale. And the same thing again. Just do that gentle lift up from the back of the pelvic floor into the belly. And as you do that, you might feel a little bit more length in that right hip. Yep. And then we're going to release and change sides. So we're going to take it to the other side. And then again, we're going to move forwards and backwards. So we're going to go forwards and backwards. Now, as we're doing this, I've just reminded myself that I said we were going to do some release for the upper body, and then we didn't do it. I completely forgot. We are going to do it, don't worry. Okay, so now we're just having the knee in line and just going forwards and backwards and doing the same thing. Now have a think about whether it feels different on this side. Feel any different? Okay. So Charlotte's just saying that it feels slightly easier on this side. Feel tighter on this side, Lucy? Yeah. So just be conscious and aware of where you may feel a little bit different from one side to the other. And maybe you do this a bit more on your tighter side. So Lucy's tighter on this side, so maybe she should favor this side a little bit more and do it a little bit more. And then remember, you can take the knee out to the side. Just do it if it feels good. Yeah, take the knee out to the side and do it. If it feels good, do it. So again, you're just rocking forwards and backwards, releasing tension. Sit. And do that a couple more times. And then we're going to come forward and hold it. So just come forward and hold it now, and just hold. And then just take a couple of breaths, just letting go, relaxing and releasing. So inhale, exhale. And try doing that little pelvic floor contraction again as you do this. So inhale, exhale. Lift up from the back of the pelvic floor and into your belly. And just see whether that gives you a little bit more opening through that left hip. And then do that again. Inhale and exhale. Just releasing through that hip. Okay, so now what we're going to do is we're going to put our balls back for a second. So we're just going to put them back. Hopefully they're not going to run away. They may do, but we won't worry about that if that happens. And we're just going to hold a kneeling position for the moment. Now, if, guys, you don't like being on your knees, you can always sit on your ball. So same thing at home. If this position is uncomfortable, then just sit on your ball. You could sit on a sofa. You can sit on some cushions. We could sit on some blocks as well. So just move your position. The important thing is that you don't stay still for too long. Yes, if you want to move, move. You can sit on your bottom as well if you want to. But we're just going to now start to focus on the upper body and releasing some tension through the upper body. So what I'd like you to do now, and this is going to be really weird, but I want you to put your hands onto your chin. I've got a work around the mic here, so you guys can do this more successfully than I can. I'm just going to go down one side. So move both fingers out and go find your jawline. Yeah, so go to the outside of your jaw. Now, this is a bit I find difficult, is go up and you'll feel the cheekbone. Can you feel that? Yeah, and then there's a little V, so come in a little bit. There's a little V, and it's where your jaw joint is. And if you just open your mouth, you can feel it move. Yeah? Okay, now there's a little V in there. Can you feel that? I think you need to come forward a bit, Charlotte. That's it. Feel it there? Yeah? Yeah, got it? It's weird, isn't it? It's a weird sensation. Now, we carry so much tension in the jaw, and you're probably thinking, what the hell has this got to do with me giving birth? Well, because of that tension here, it can transfer down to the rest of the body. So we're going to try and just release the jaw. So just do some little pressing movements into that little V into your jaw. Okay, and just press into the right and release the left. Okay, now press into the left and release the right. Does it hurt more on one side than the other? Try it again. Which side? Hurts more on the right. Okay, so often we have more tension in one side than the other. So now you're going to just press into the right side and hold it there and really press and press and press and press. And then take your finger away. And just move your jaw. Feels a bit weird. Okay? Now press into the other side. So press into the left and press and press and press. And keep pressing. And then release. Okay? And it just helps to release your jaw. It'll feel a little bit weird. Okay, we're going to take some tension away from the neck now. So now just press your right shoulder down and just gently take your head over to the left. And just try and release some tension through the neck. Now breathe. Do that breathing for me again. Inhale. Exhale. And relax. And you're pressing your shoulder down and back. Yeah, you're just trying to press the shoulder down and back, but very gently. And again, do it again. Breathe. Inhale. Exhale. And just take your head gently over to the side. And then we're going to change it on the other side. So again, press the shoulder back and down. And then take a breath. Inhale. Exhale, and take the head over to the side. So how does that feel on your neck, Charlotte? You feel tension? You feel your jaw feels funny? It should actually, doing that pressing in should actually have helped to release it a little bit there, yeah? Okay, so now we've stretched through the front there. We're going to stretch into the rear of the shoulder. So you're going to grab your ball again. And what we're going to do is just take the arm across the ball. So get your right arm across the ball and just look over your right shoulder. And you're just stretching through the back. I don't know if you can feel that. So it should give you a nice stretch through your shoulder, the rear of your shoulder. And then we're going to change sides and do the other side. So just take the shoulder across. So if you're getting any kind of aches and pains around the shoulders, the neck, all of these positions are really good to do. And then we're going to stretch through the chest wall. Put your right hand onto your ball and send your ball over to the right. We're going to put the left hand onto the floor. And then you're going to drop your chest down. And you should feel a stretch coming deep across your chest wall. Don't know if you can feel that. Okay, and then lift up and change sides. You feel that stretch? Yeah? Okay, and then over to the other side and then press down. Okay, and then release it. All right, we're going to put our balls back again, and now we're going to focus on the hips again. So just take the ball back behind. Don't know if my ball's going to stay there. Da, da, da. Okay, so now we're going to come forward. So we're going to bring the right foot forward. Now, if you experience any pain or discomfort in this position, I'm going to give you an alternative in just a second. So just hold on for me for one moment, and I'll give you an alternative in just a second. Are you okay in this position? So we've done this before in other sessions, but what I want you to do now is just rock from side to side. And what's so lovely about this is, again, we're using those rocking movements, which is so nice to do. And as you're rocking, you're thinking about releasing tension in the right hip as you go to the right, releasing tension in the front of the left as you go to the left. So it should be a nice feeling. Yeah? Now, sometimes your knee hurts a little bit as you do this, so you can always grab a block and put it underneath your knee. Yeah? And it just protects it a little bit. So you can grab a cushion or a towel at home and do the same thing. So just rocking side to side. And again, just helping to keep those hips moving nicely and releasing tension. You okay? Yeah? It's a nice move, isn't it? Okay, now, if you don't like that position, instead, you guys keep doing what you're doing. I want you to just cross your right leg over your left, take your hands over to the left, and just sit back to the right side. And this is an alternative, particularly if you feel any pain or discomfort in the other position that the girls are in right now. So you can just hold that position, and you can rock it as well. If it feels good, you can rock. Okay, and then let's change legs now. So other side. So I'm going to do that alternative. If you guys just bring your left knee up, extend your right leg. You can always put the block underneath your right knee. That's it, and then just rock again. If you feel any discomfort in your front knee, just lift yourself up taller so you're not sitting down onto your knee joint and closing your knee joint too much. So your alternative again is to cross the left foot over the right, take the hands over to the right and just sit your weight back to the left-hand side. And again, you can rock it if you want to. If it feels good, do it. Now, is that hip feeling tighter? Does it feel okay? Feels good? Yeah? Okay, so again, the girls are saying they've got differences in each hip, so just be conscious of it and think about trying to release and relax those tighter sides just a little bit more. That's it. Okay, so we're going to bring the ball back again now and just finish off with relaxing moves on the ball. So this is the best thing about using the ball. You can really relax over it. So what I want the girls to do now is just find a position that they find really comfortable. So you might want to turn your head to the side. And again, you can just roll around a little bit. But what I want you to do as you're doing this is just focus on your breath. So just take some nice big deep breaths and go back to that Ujjayi breath. One of the reasons why I like it so much is it does resonate with your core as well. It helps you to kind of focus on this area. And that's really nice because it's kind of bringing you into, intrinsically into bringing your mind into your pelvic area and your birthing area and that all-important, powerful uterus that's going to push that baby out for you. And the more tuned you are to it, the more you think about it, the more you consciously connect with it, then the more naturally your body is able to do what it's designed to do. And you are incredibly powerful. You have the most amazing body. It's designed to do this, and it can do this, and it will do this. And the more you relax into it, and the more you trust yourself to be able to do this, and I completely trust you. I know you can do this. It really is something that's within your power. So try to do lots of these kind of exercises. Just relax, release, connect to your body, and I promise you everything's going to be just fine.